Beverly Hills, land of the rich, home of the famous. Sure, the stereotypes exist, but what most people don't know is the truth behind the plastic. If there is anything I have learned in all my years as a plastic surgeon, it's that appearances are not always as they seem. I get patients from all over the world, from celebrities to the average everyday housewife. But there is one thing they all have in common. Everyone needs a lift. Welcome to my world.
I'm Grace. I'm 62 years old from Los Angeles. I came to see Dr. Kassabian because I've gotten to the point in my life where I feel like it's time to take care of myself. I spent most of my life taking care of others. At the age of 10, my mom passed away, and my dad was left to take care of a growing young girl and wasn't really sure how to do that. So I grew up kind of out of style and kind of awkward. Got picked on a lot, did not have a very good self-image at all as I was growing up. But I made it through, and when I was 17, my dad passed away, so I put myself through college and got married, had 2 boys of my own that are now grown. But the marriage didn't last very long, and I raised them by myself. And sometimes working 2, 3 jobs or whatever I had to do to raise my boys. I've gotten to the point in life now where I'm an executive with a large company. I've gained my confidence and my success, and now I feel like it's time for me to take care of myself and do all the things I want to do so that I can start this new chapter of my life and finally do things for me. I saw Dr. Kassabian on television on the show, and I was on a business trip watching TV one night, and there he was, and I was very impressed by the way he handled himself. I did quite a bit of research after that and was very impressed with what I saw. And that's why I came here today to talk to Dr. Kassabian about having a breast reduction and lift, which I've wanted for many, many years. And also I'm at that point in my life where I think I may want to do some things to tweak my face a little bit and get some refreshing things done to my face and see what he has to say.
Hi Grace, I'm Dr. Kassabian.
Nice to meet you.
Nice meeting you too. What brings you in today?
Well, a couple of things I'm looking to get done. Mostly I'm here because I'd like to have a breast reduction and lift. Been wanting that for many years. And also want to see what you can do about getting a little facelift of some sort, getting the jowls taken care of, the drooping, and I don't know if you want to do anything with my eyes, but whatever suggestion you have, I'm interested in hearing.
Sure. Well, let's start from top to bottom.
Okay.
What are the issues with the eyes? What's bothering you there?
You know, there's a lot of wrinkles, and it doesn't look like it until I smile. There's a lot of hollowness. I had some eye work done many years ago, and it left quite a bit of hollowness under my eyes. The lids are starting to droop a little bit, and then of course I've lost volume in through here, and definitely the jowling.
Yeah, skin on the upper eyelid. Well, this what I'm seeing here. Again, the brow is at a little lower position. There's some extra skin on the upper eyelid, and then, like you mentioned, the fact that you had the lower eyelids done before, the fat was removed, and genetically your cheeks are positioned in a lower position, so that's why you get the pronounced hollowness there. So, and also the forces over time with gravity from top and diagonally, they gather here. So as the cheek descends and this area in front of your ear descends, everything gathers here, and that's why you see the jowling, okay, and then the changes in the neck. We can address all these at the same time, and I have a new method of lifting, which is a long-lasting procedure but gives you a very natural result, and that's to lift up the cheek from inside the mouth, okay, and that will put the cheek in front of the cheekbone. So at the same time, it's gonna reduce this distance, reduce the hollowness underneath your eye, okay, and then we go in and tighten the muscles in your neck and in the face area, and then and then get rid of the excess skin in that area. And automatically, once the cheek comes up, the tail of the eyebrow is going to come up, and then we'll refresh the loose skin around the eyes. Okay, and then the hollowness here, I'll add some fat injection to smooth that tear trough area. And then you need some fat here in the corner of the mouth in the laugh line. So that would look very nice. So that procedure is about 3.5 hours or so, all right? And then let's come to this. So what are your concerns in the chest area?
My breasts have gotten very, very heavy over the years, and it's taking its toll on my neck and my shoulders and my back, and you'll see I have very deep indentations from bra straps, very uncomfortable, hard to even, sleep at night, hard to find clothes that fit. It's just gotten to the point where I'm over it. I got to do something with them. I was always a D cup, a 34D all my life, and that was fine. But as I've gotten older, they've probably tripled in size, and it's gotten to be just cumbersome, too much, just too heavy.
So that's the reason to do this surgery, because it's a burden on your neck and on your back and on your shoulders, to minimize that burden. And you see it in the before after photos immediately. The shoulder starts straightening out this area. The posture becomes better. And I've had patients where they've thought they've had asthma before, but immediately after surgery they're breathing better. So all that heaviness is gone. So I'll examine you and see how much reduction we need to do. Of course, you're going to need a lift with that. So that will be done at the same time. Okay, so next I'd like to then have you change, and then I'll examine you and do some measurements, and we'll go from there.
Okay, thank you.
21. Okay, so what cup size do you think you want to end up with?
C.
A C cup. And right now you're?
Triple D.
Triple D. Okay, and how tall are you?
5'5".
5'5". Okay, all right. So yeah, it's gonna be like a small D, full C, somewhere there. Okay. So the incisions are gonna go like around the areola, down and to the sides. They'll be hidden within the fold. Okay, you'll have 2 drains coming out. Most of the stitches are from the inside, a few temporary on the outside.
The drains are in for how long?
A couple of days, like 3 to 5 days, depends on the output. Okay? All right. Well, to recap, this is the plan, is to give you rejuvenation around the eyes that consists of a lateral brow lift, the brow lift from the sides, and then revising the upper and lower lids at the same time. The cheek lift from inside the mouth to put your cheeks in front of your cheekbone. And then tighten up the skin in the lower face and the neck area by tightening the muscles here, and then getting rid of the excess skin. And doing some fat injection in the under eye, in the smile lines in the corner of the mouth. So that would be fantastic. As far as this is concerned, you're gonna need a lift with reduction. This procedure takes about 2.5 to 3 hours. You go back to work probably, as far as the face is going to be presentable within 2 weeks.
And we do it all at once?
Yeah, we can do it at once, or I'll start with the face. If that's taking a long time, then we always have the option of doing it the following day.
Okay.
That's not a problem to do. Okay.
I'm very excited. I've done a lot of research before I came to see you. I saw your show. That's what brought me here. And I've looked at all your work. I've looked at your befores and afters, and I've seen it all. I'm really excited. I feel confident in your hands, and I'm just ready to get going. I've been wanting this for a long, long time.
Fantastic. Well, I'm looking forward to it. So if you have no further questions, we'll move forward with it.
Sooner the better.
Okay, great.
Thank you.
Nice
Thank you, Doctor. What a pleasure. I just had my consultation with Dr. Kassabian. He's exactly as I assumed he was going to be from seeing him on his TV show. Very mild-mannered, very sweet, very patient. He explained everything to me that's going to be done. We went over everything that has to happen to be able to reduce my breast size and lift my breasts. And everything he told me about working on my face it's going to seem very natural, and it's not going to look fake in any way, rejuvenated. I'm really excited to have this done. I've been looking forward to this for so long, and I'm waiting for the day that I can set the date and get this over with and do it finally and really treat myself and make this dream of having this happen for a long time come true. Well, here I am on the day of my surgery. Finally, the day is here, and I'm excited, but I get a little scared. I think it's normal. I wouldn't be human if I wasn't. But I will tell you, I'm in really good hands. They have taken care of everything. They've crossed every T and dotted every I, and I've met the anesthesiologist, and everybody is very, very, very thorough in Dr. Kassabian's practice. So I'm in very good hands. I know that. And even though it's a little scary, it's still very exciting to finally get going on my new lease on life, and it's been a long time coming.
Good morning, Grace.
Good morning, doctor.
So good to see you.
Thank you.
So the day is finally here, the day we've been talking about. Okay. So the procedure is going to start with the facial rejuvenation, and then we're going to do with the breast reduction.
Wonderful.
Okay. Any last minute questions for me?
No, I know I'm in good hands.
All right, fantastic. Then give me a hug and let's
All right.
get started.
All right, thanks, Doc.
Getting ready to start Grace's surgery. Procedure should take about 5.5 hours, and she should do very well. Done with Grace's surgery, which was the facial rejuvenation and the breast reduction with the lift. Procedure went very well. She's recovering right now, and then from here she'll go to a recovery place overnight, and I'll see her in follow-up tomorrow.
It's been 3 months since my surgeries with Dr. Kassabian, and I've got to tell you, it's changed my life. I can't even tell you how great I feel. I can't tell you how glad I am that I did this for myself. I've spent most of my life taking care of other people, including raising myself and my brother since I was 10. My parents died when I was very young, and I had a long road, and the road I've walked started to really show, and it was an amazing transformation for me to finally have a face that felt like my insides, a face that felt young and vibrant and energetic. And I'm in my 60s, and I thought it was just time to take care of it and do what I needed to do for me finally. I raised 2 beautiful young men, and I have 3 grandsons, and I still continue to do things for them all the time, which is what I love to do. But boy, this was a big step in taking care of myself. The breast reduction was life-changing. It made me feel so much lighter and thinner, and I feel better getting dressed in the morning. I'm still in the workplace. I don't have to worry about disguising myself when I get dressed to go to work. I can wear sundresses again and not have to worry about the enormity of what I was carrying around. Not to mention the fact that my shoulder has no pain at all, and I couldn't even lift my right arm. I feel energetic and I feel full of life again. Dr. Kassabian was amazing. He was so caring. His whole staff is amazing. Every little detail was followed up on. Everything he could possibly do to take care of me, he did. They really care. I think it's evident in what he does for his patients. And I couldn't have asked for better care. Everything went very smoothly, but he was on top of everything I needed. And once again, best thing I've ever done for myself. I wouldn't do it any other way.
Hi, Grace.
Hi, doctor. How are you?
Very good. You look fantastic.
Thank you.
Wow.
Everybody
It's been
says
3
it.
months.
Yes.
Yeah, you look great.
Thank you.
You look exactly what I was envisioning
Good.
for you to be.
Mm-hmm.
Because when with your level of energy, I was envisioning this energetic, youthful face.
Oh, and thank you. I couldn't be happier.
Yeah.
Very happy.
Yeah, everything looks very natural. Things are looking nice. The eyes are nice. Cheeks in front of your cheekbones and gives you that youthful look, and it gives your eyes the glow, you know?
Yeah, I'm not drooping anymore.
Yeah, and at the same time lifts up the corner of the mouth, gets rid of the jowling, and then here the lower facelifts makes your jawline better, your neckline better. So I'm loving this. I'm loving it.
Thank you. I'm loving it too. It's amazing.
Good. And at the same time we did the other procedure, the breast lift and the reduction. So how's that healing?
It's healing beautifully, and it's life-changing.
Yeah.
I have to tell you, I don't have any pain in my shoulder anymore. I can wear clothes I couldn't wear before. It changed my life.
Yeah. Well, it takes a great weight off your neck and back, right?
I swear I can breathe better too. I don't know if that's just my imagination.
No. It's real. I've had a lot of patients after doing this procedure in the recovery room already, where they thought they had asthma. They're like, oh my God, I can breathe.
I know.
So much better.
That's the way I feel.
So it's just that all that weight on your chest wall, well, it looks like everything's healing very well. I'm liking what I'm seeing. The scars are very nice. Then I'll see you in follow-up like in 3 months.
Okay, I have a favor to ask you.
Yes.
If you have any retired, single, handsome doctors that would like to meet a single lady, please let me know.
Will do. So good to see you.
Good to see you too. All right. You know, I was a little afraid to do these procedures, because whenever you are going under the knife and you're going under anesthetic, there's always a certain amount of fear. But when I look back, I've got to tell you, it's truly the best thing I've ever done for myself. Don't be afraid. Face your fears if you have any, because spiritually and physically and emotionally, I couldn't be in a better place in my life right now with the new me. And I feel like my outsides match my insides. Don't hesitate. It's really, truly a life-changing experience to do something like this for yourself. And I would never hesitate to go back and do it all over again.